Debate. The honourable member for Nickel Belt.
Mr. Speaker, it is an honour for me to speak to Canadians about M-106, my motion calling on the federal government to take action to help improve quality of life for seniors in Canada. I would like to thank the honourable member from King Vaughan for her excellent work on the Seniors Caucus, and also to all the honourable colleagues on both sides of the House for their work towards improving seniors' lives and conditions in Canada. I would like also to thank the Honourable Senator Sharon Carstairs for working with me and for reminding me that there are as many ways to age as there are people aging. Also, seniors should be defined by how they live and not by their age. Above all, I want to emphasize that we should view the aging population as an opportunity and not an obstacle for Canada to update a wide range of public policy. Monsieur le Président, j'ai grandi avec mon père qui avait 16 frères et sœurs et ma mère qui avait 15 frères et sœurs, deux grandes familles catholiques canadiennes-françaises. J'avais plus de 60 oncles et tantes. Je suis fier d'avoir grandi au sein d'une grande famille chaleureuse qui a su m'appuyer. D'autant plus que mes parents, mes oncles, mes tantes vieillissent tous. J'ai eu le plaisir de rencontrer des personnes âgées chez elles, dans des centres d'aide à la vie autonome, partout dans mon quartier de Nickel Belt et du Grand Sudbury. Tant d'aînés m'ont dit qu'ils ont de plus en plus de difficultés à rejoindre les deux bouts, qu'en dépit de tous les efforts déployés par les médecins, le système de santé, les programmes sociaux au Canada ne répondent pas tous à leurs besoins. Aussi, qu'ils veulent demeurer autonomes le plus longtemps possible chez eux. That, Mr. Speaker, is why I believe that today's debate on Motion 106 is so important, and that the aging of Canadian society requires ongoing and serious attention. By 2035, 25% of the population is projected to be 65 or older, and are expected to account for 60% of healthcare spending across provinces and territories. In my mind, there is little doubt that this is unsustainable. That's why M-106 calls on the government to recognize that improving efficiencies and quality for care for seniors should be a critical priority for the federal government, as the future of Canada's social safety net, not just for seniors, but for the entire population, is at stake. Secondly, Mr. Speaker, M-106 asks the federal government to take action to improve the quality of life for seniors, as I said, as there are undoubtedly many Canadians who are listening and participating in this debate. I believe the time is now for the federal government and the members of Parliament to speak directly to them, to clearly inform Canadians about what the federal government is doing to improve the quality of life for those who are considered seniors now, as well as those who will soon be considered seniors soon. Thirdly, Mr. Speaker, M-106 asks that the Standing Committee on Human Resources, Skill and Social Development study the important issues related to the aging of Canadians that will inform and develop a national senior strategy, something that more than 49,000 Canadians have demanded by writing letters to their MPs as part of the Canadian Medical Association's Demand a Plan.ca campaign. In August of 2015, Toronto Star article, Dr. Chris Simpson, past president of the CMA, called seniors' care the most pressing public issue in Canada today. He said, if we fix seniors' care, we will go a long way to fixing our healthcare system. Je crois que cela finirait par porter préjudice aux Canadiens si la Chambre se contentait de proposer un projet stratégique nationale pour les aînés sans d'abord les consulter. Lors de l'élaboration d'une telle stratégie, on devrait tenir compte des commentaires des experts, comme des universités, des soignants, des médecins, des membres des associations locales et nationales, des administrateurs d'hôpitaux et des résidents avec des services, ainsi que les aînés eux-mêmes. Voilà pourquoi je demande au Comité permanent des ressources humaines, du développement des compétences et du développement social de réaliser une étude qui éclairera l'élaboration d'une stratégie nationale pour les aînés et au cours de laquelle les témoignages aideront le comité à rédiger son rapport et à formuler des recommandations et, au bout de compte, à déterminer ce qu'est une stratégie qu'on doit viser. I will, however, suggest 6 sectors of continuing care that the development of a national senior strategy should seek to address. The first sector is wellness and prevention. A national senior strategy should highlight best practices for improving the social determinants for seniors. There are conditions in which people are born, grow, live, work, and age, such as secure income, stable, affordable housing, social connections, active lifestyles. In doing so, we will reduce the strain of seniors seeking acute care at hospitals. The second sector that the national strategy for seniors should address is primary care. Primary care can be defined as highlighting best practices for integrating primary and specialist care, facilitating greater availability of advanced training in aging and palliative care, and building knowledge of how to facilitate advanced care planning, while including fraud and injury prevention, health promotion, illness, chronic health concerns. At the same time, more than half of our seniors claim that they take 5 or more drugs from different classes. And 20% of seniors reported that no medical practitioner had reviewed their medication regime in over a year. The lack of integration among healthcare systems causes real strain on the healthcare system, and the CMA reports that between 2006 and 2011, there were almost 140,000 hospitalizations for adverse drug reaction for seniors in Canada. The third and perhaps most important national senior strategy should focus on home care and community support. According to CMA, caring for seniors at home and in their community, as opposed to hospitals, is one of the most cost-effective ways that our healthcare system can meet the needs of seniors who are not fully experiencing Alzheimer's, dementia, or are critically ill. Clearly, a national senior strategy should focus on developing and implementing of policies and best practices that encourage treating seniors in their homes and enabling seniors to live in their communities as long as possible. This is something that 9 out of 10 seniors have said is of critical importance to them. Home care is also the most cost-effective and is what seniors want themselves. The 2009 Senate report on aging, tabled by Senators Carstairs and Keon, notes that family and friends provide about 80% of all home care to seniors living in the community and up to 30% of services to seniors living in institutions. As a national senior strategy should pave the way for a comprehensive plan for families, caregivers that take into consideration both the financial needs of family members as well as caregivers who provide home care and the stress, the financial burden that they take upon these results. Le quatrième secteur, Monsieur le Président, donc devrait traiter la stratégie nationale pour les aînés est celui des soins de courte durée, et des soins spécialisés, généralement offerts dans les milieux hospitalisés et habituellement sous les formes d'un court séjour à des fins de traitement pour des affections graves. Il y aura davantage de patients recevant ce qu'on appelle d'autres niveaux de soins. Au fur et à mesure que la population vieillira et que de plus de Canadiens tenteront d'avoir accès à des soins à domicile ou à des soins de longue durée, la stratégie nationale pour les aînés pourra s'attarder au rôle que le gouvernement fédéral peut jouer dans la réduction des temps qui doivent attendre les personnes âgées pour accéder aux spécialistes et une meilleure coordination entre les niveaux de soins. Ainsi, ces personnes ne resteront pas coincées dans des lits d'hôpitaux à recevoir d'autres niveaux de soins en entendant d'autres transferts à un centre de longue durée ou être ramenés chez elles. Le cinquième secteur auquel la stratégie nationale pour les aînés devrait s'attaquer est celui des soins de longue durée. La part des gens âgés qui vivent dans des établissements de longue durée éprouvent des problèmes de capacité cognitive et leur santé physique s'est dégradée. Et celles ont de la difficulté afin d'accomplir des tâches quotidiennes. Nous devons nous préparer à un afflux de demandes dans le secteur. À mon avis, pour ce faire, le gouvernement fédéral devrait investir davantage dans les résidences à personnes âgées qui sont abordables, adéquates et dans le secteur coopératif. Lastly, the sixth sector that a national senior strategy should focus and study is palliative care. According to CMA, starting palliative care early, combined with medical treatment, provides better pain and symptom management, better patient and family satisfaction, and an increased livelihood that a patient passes away in the setting that they prefer. The development of a national senior strategy can look at ways that the federal government can make palliative care more affordable, more accessible to people living in remote and rural areas, how to provide greater access to palliative care for those with disabilities and Indigenous communities, and how to greater support for family givers who are so essential for the delivery of palliative care for their loved ones. Now I would like to briefly go over how M-106 calls for the mandate of the National Seniors Council to be broadened. My motions ask the federal government that broadening the mandate of the National Seniors Council to allow it to be better reflect the diversity and experience and expertise among its members. Currently, the National Seniors Council has a mandate to undertake extensive research, commissioning, conveying experts, panels, roundtables, and holding meetings to provide advice to the federal government, but only as on a need basis, at the direction of the minister. M-106 seeks to empower the National Seniors Council by broadening its mandate to determine research priorities, projects of its own initiatives, where in the past they were directed by the minister to conduct research without consultation from the Council. Broadening the mandate of the National Research Council would, in a sense, enabling it to conduct timely and relevant research for the federal government, and in doing so, enabling policy makers to set budgets, craft legislation, plan for the future with better research data to back up the decision. To conclude, as my first private member's bill, I would like to take the opportunity to thank the people of Nickel Belt for their trust, to thank my lovely wife for all her support that is here today. Happy birthday on Monday. Also, a big thank you to my dedicated staff, hardworking staff, Anne, James, Rebecca, Janique, Stephanie, Kim, and Sherry. Thank you so much for your dedication and devotion. Lastly, Mr. Speaker, I'm asking all Canadians to reach out to seniors. Take the extra time, volunteer. Reach out to seniors who have built this wonderful country. I'm asking all MPs to count on your support for M-106. It's the start of an important conversation to improve the quality of life for all seniors living in Canada. Thank you. Merci, Miigwech.